right? I make a reasonable estimation that, you know, you function reasonably well and it can be suitable for this. We'll take a look at some motions before and afterwards, and then we'll see how dry needling affects your condition afterwards. Is that fair enough?
Mm-hmm.
So, we're thinking about addressing your lower back issue today with some dry needling. So can you give me a little summary of what's going on right now with your lower back?
If I sit for a long time, of course. This is what my grandkids say, walk like a granny. I'm always walking like this.
Okay.
Always walking hunched over in my you know, what's the typical thing you walk into a store, you grab the cart so that you're not
Got it.
walking hunched over all the time.
Okay. Got it. So right now at this moment, do you experience any pain?
I mean, I feel it, but it's not
Okay. All right. So what we'll do, if that's okay with you, is we'll take a look at some basic movements and see how that is for you. I'm going to move this a little bit here to give us a little more room. What's that?
I wonder if I should go to the restroom.
I think you should. Yeah. Let's
Before we get started.
Get a pause. So you're going to just take a restroom. So right now, a little discomfort in your lower back.
This morning, well, no, it's not bad right now.
Okay. Sounds good.
Last night it was really bad. But
Got it. So maybe bend forward to touch the floor to the extent that you can. And she doesn't look like she's really willing to go down very far, just to the extent that you can comfortably. And then come back up. Is that bothersome at all?
it feels good. Good stretch. You know, you
Does
want
feel
it
good.
to feel.
Okay.
You want to stretch.
See how far your fingers can go down towards the floor if you just slide them along your shins. So get to about the front of the ankles there. Okay.
Yeah,
And come
feeling
back.
that, of course, in the back of my legs more than
Okay. Fair enough. So coming back a little bit there. Okay, so she has a catch coming back there. So we'd like that to be smooth and easy all the time, right? Next thing I want you to do is take your right hand and just see what it's like to slide down the right side. And I can see she's grimacing. You can't see that on camera though. Come back up just to the point that's reasonably comfortable. Okay. So you start. We can do that too. That'd be all right. And to the left. And she's still smiling here, but she starts to grimace there. So I'm not sure what this looks like from the back, but we'll take a look. So go ahead and to the right again, please. Right there, she's struggling to get that movement. Kind of stutters there a little bit and come back. She's trying to be good. She's trying to get as far as she can. This side, much more willing to move, but still a struggle at end range. These are basic movements of the spine someone should be able to do because they indicate that the person can be able to stand upright more easily if we can side bend easier. People don't usually do side-to-side movements in their daily life, but they indicate that the spine is healthy for a backward bend movement. So if you would, I'm going to I'll show you before we do this. Put your hands right here. Allow me to get back there before we do this, but I'm going to press your hips forward as if to bend backwards. Let's see what that's like.
Probably do that with my shoulders.
To the extent that you can. Any bother there?
Well, yeah.
Okay, great. Okay, come back up.
More back.
So, and kind of get that catch, kind of see that coming back up, so we definitely want to address that. So there's a fair amount of lower back. Any surgery in the past in your lower back? Okay.
Spine or neck. A discectomy in my neck.
Hold on.
A discectomy.
A discectomy in the neck, okay. So, you know, this is a limited examination here, right? I would be taking a look a little more fully at her hips as well. That's a little beyond the scope of this 5-minute miracle. So what we're thinking about is trying to improve the movement capability with needling for this area. So, more probably what I would either way. All right, so this is a clean technique. This is not a sterile technique, so this is going to be cool because I'm using an alcohol swab. This is also a clean technique. I do not need to use gloves. Some practitioners choose to use them. I'll use them if I need to clean up anything at the end. All right. So we're going to take a look at needles in along her paraspinal. So if you take a look in the center of her spine here, that's going to be her spinous processes, or the bony projections that come out, and along the side of these paraspinal muscles. think we're going to use a number of needles in here on each side, and then maybe some on the sides to really get a good, robust activation through this area. First set of needles are going to go into what we call the sacral base, or where the lower back is. Just going to feel a little ting, and then there we go. In this instance, we're using 50 millimeter needles, and we're going to apply them as deep as we can comfortably. There's not a lot of organs under here to be worried about, or arteries. You certainly can't get through the vertebrae to the spinal cord, especially with 50 millimeter needles, so this is a very safe application. We're going to move up the spine a little bit. Next segment we're going to do is what we intend for to be about L5, lowest lumbar vertebrae. How you doing? Feel this much?
Not much.
No. Most people that are lower back don't feel a whole lot.
I can feel it, certainly.
That one's
A little
stick,
tinny, yeah.
stickier to go in, right? That's an area that's a bit sensitive.
Huh. I can't imagine that I would look forward to coming to you every, however often
Is
you
it
do
right?
it. Huh?
There are some people literally who can't wait to come in for the
Yeah.
next needling session, but
I suppose. If
a lot
it's-
of because it's helpful, right?
Right.
Other people like, yeah,
Yeah.
I'll manage it because it helps.
Mhm.
I've got one customer who's like, he can't wait to get needle next. And over time, there should be less sensitivity in these
Yeah.
areas as we treat secondary
I didn't
instances.
feel that one at all. The last one you did, I felt pretty good. But those last two, no.
So these are in those paraspinal muscles, and they're also directed right towards the bony portion of the spine, called the lamina.
Mm-hmm.
So now we're going to get a little bit more towards the side of the muscle along the spine. I'm angling this a little bit differently. Because we're very, very worried we might run out of needles, but we've got plenty on board. So we're going to do one more on that left side, and then we'll do the same on the right side. Nice.
That's it?
That's it. So we have a fair number of needles in here. 12 total. We're going to stimulate these muscles along the spine.
What's the difference between the color coding?
So in order to have a current, you need a positive and a negative.
Oh, okay.
In this instance, not a lot. This is alternating current. This is operated by D batteries, so it's not overly powerful, although if I turn this up enough, she'll feel it. We're just after a bit of activation. We're not after like, this shouldn't be a overly bothersome stimulation, especially for the first time.
I recently got a stimulator for my feet, which you just put your feet on.
Yep.
Turn the current up, zap, zap, zap.
Mhm.
It's, it's supposed to be less inflammation, and I mean,
Sure.
we get to this point where we're grabbing at anything, right?
Right.
That's gonna help us.
So on the left-hand side, we're turning up the electricity.
Feel it,
to
feels
the
like
point.
a TENS unit, yeah.
So she says it feels like a TENS unit.
Mhm.
I want to turn it up till she starts to feel it. In this instance, I don't think we're going to get a lot of robust muscle activation. This is her first time. I don't think there's a need to be that aggressive to get to twitching in this instance. If it was kind of a shoulder application, we'd probably get some of those rotator cuff muscles to twitch.
I feel it.
You made my neck twitch. I could
Oh, yeah.
feel that.
One part, that's because you deserve. No, just kidding.
Oh, see, I knew it.
Yeah.
So, just joking, Karen. So,
Sure.
in this instance, needles are in place. We'll hang here for a few moments.
So it's all in your head if you feel it one side versus the other a little more.
Not necessarily. You feel it a little bit more on your left side.
I do.
Okay. So as I look at the values on the right side, they weren't quite as high.
Okay.
How about now? Feel a little more even? Perfect.
And it seems like it's pressure, more pressure at the bottom. Feels like pressure. Like,
Mm-hmm.
I don't know how to explain.
Different areas might be a little, when we insert a needle on that particular day, that area might be more or less sensitive, if you will.
Sure.
But also on those lower ones, we went much deeper, deeper towards the bone tissue, so
Okay.
she might be feeling that a little bit more.
Yeah.
I'm not sure, right?
Okay.
We don't know.
Mm-hmm.
So, in terms of comprehensive treatment for somebody with a lower back condition, Vicky has a generous forward curve of her spine. You know,
Kyphosis versus lordosis.
excessive lordosis in the lower
Yeah,
spine.
and I won't forget it.
What is that again?
Forward curvature or lordosis. It could be associated with some tightness in her hip joint capsule and muscle, hip flexor muscle. And that's certainly an examination, one thing that we're going to address to see if she's got tightness there. Because if she's having trouble with standing and moving right to left, then she's going to have difficulty with getting up fully in that tightness in the muscle will be pulling her spine forward. So one of the things we want to do is we want to use needling in areas that are bothersome. But one of the reasons needling in combination with hands-on work and exercise is effective is because we're not just working with the area that has the yowie, the pain. But we recognize that this lower back is influenced by multiple areas that include the junction between the lower back and the mid-back. Tightness in this mid-back region could be influencing it, tightness in the hips, potentially tightness in the knees. I did a little bit of a screen with her before. We didn't see this on camera, but she was able to bend forward to pick up that pen and reach quite a ways. So her hip flexion, her hip mobility in knee to chest is pretty flexible. I didn't need to do that assessment. Oftentimes people have significant tightness in their hips in being able to do that. And if we don't address the areas above and below, our results aren't as good. What I've noticed over my career is that when we focus on any one particular treatment, about a third of the people are really happy. And a third of the people are like, yeah, it was a little bit beneficial. And a third of the people would be, meh, it's subtle. That's being Wisconsin nice where it didn't matter at all, right? And no matter what technique I learned, that seemed to be about the ratio of improvement that I noticed. It wasn't until we started kind of combining the fact that we need to do oftentimes not only multiple types of treatments, but not just localized treatment in one area. So for our successful plan of care in physical therapy, dry needling is a part of that. Like I mentioned, I am very reluctant just to have somebody come in and use dry needling because I think they might be wasting their time and money. If someone's convinced that they want that, we'll do that. It's when it's combined with other things that are helpful, right? So one of the things that makes me really excited about being a doctor of physical therapy and providing the treatments that we do is because there's multiple things that we do that have really good research evidence and clinical evidence. We can do mobilization and manipulations of joints. We do that all the time. We loosen joints up to move better. That can be really effective. We combine that with an exercise prescription. We know that exercise helps to relieve pain. We can use deep massage work. We can do massage work with our hands or with tools. It's called instrumented soft tissue mobilization. that has really good beneficial effects in and of itself. We help people with strengthening, that is building up strength in the muscles. For lower back conditions, that oftentimes involves the hips and the legs, in addition to the muscles in along the spines, to help over time increase the resilience so that pain doesn't come back as often. For someone with a shoulder issue, that'd be like making sure there's enough strength to make sure that reaching up and handling objects in and out of cabinets is robustly strong enough that you don't have to be fearful of your shoulder for that. And you don't feel like you don't have enough power for that. So it's the combination of those things, in addition to dry needling, when someone's interested in, and when someone has the doesn't have any reasons not to, if you will, no contraindications. Most people can have this done, right? So multiple types of intervention, treating the whole body as a unit rather than just one isolated area. That's where we tend to get the really robust results, right? So I'm always glad to say that we're the only profession really that focuses on all those things at once. That's what we do, right? I mean, that's our bread and butter. So.
You treat the whole body.
So do you feel any difference now during the treatment than you did when you first started this? Or is it about the same? Okay.
So yeah, we're gonna keep her on this for a little while. What we're really interested in, hey, is there some post-treatment ease of movement in terms of forward bending, sideways bending? We had a chance to see that before. We'll get a chance to see that again, and see how that is. Even if there's not a robust change with that, there's chances are this still can be really helpful, but we'll follow it, we'll see, right? Most of the time there's a nice improvement afterwards. What I'm going to cover is when we talk about how to be a good healthcare consumer is having your questions prepared ahead of time. I like that. So here we're just removing these clips. We'll disinfect them each a little bit later. Again, the electrical stimulation at higher levels could stimulate those muscles and make them jump. I wasn't going to torture you today with that. I didn't think that was a necessary part of the treatment.
Should save that for next time.
Right.
When nobody's watching.
Yeah.
Well, usually the second, third, fourth session, people start to tolerate higher levels of stimulation. And if we do too much too soon, that's not a good, I mean, anything too much is not a good thing, you know? Water is good, but it could drown you, right?
She's gonna turn her over.
Apparently. There we go. All right, so now we're just going to take those out. We always do needle counts in and out. She's not having any areas that are any drops of blood. That's good. We dispose of these needles in a sharps container. Just wait for a minute. See a little bit of redness around the areas where the needles went in. A couple areas in which her body's kind of building the clotting, so there's not blood droplets at the surface above the skin. Otherwise, it seems to be a typical reaction.
Okay.
Okay, what's your initial response? And let's hold off on the movement right now if you can.
Yeah.
Didn't really have a high degree of pain and rest before.
Yeah.
We'll check some basic movements here. So if you would, please go ahead and bend forward, please, at the touch of the floor. And come back up. What'd you notice, Karen, about that?
That's better. Didn't smell like catching.
No
Nice
catch.
and smooth, yeah.
Exactly. So it's quality of movement, it's
Yeah.
range of movement. I'm doing the happy dance inside because another 5-minute miracle is going good.
I think so.
But more importantly, she seems to be getting a good response to this, right? Now we'll have you slide your left hand towards the left.
Left, your other left.
back up. She's smiling that way and the other way.
No grimacing?
I don't see any grimacing unless she's got a good poker face
I
there.
can't see from here. I don't feel that catching when it, to come back.
Beautiful. Beautiful. And then just to the extent you can, don't strain your shoulders too much. Go ahead and bend backwards. That's a lot more available. Nice.
Mm-hmm. Yeah,
That's a phenomenal outcome.
incredible, really. I mean,
Phenomenal
I don't,
outcome.
yeah, I mean, I can feel a little bit of the catch, but yeah.
Tremendous.
Mm-hmm.
Thank you so much. All right. So introduce yourself and tell a little bit about what brought you to 5 Minute Miracle in the workshop and what your response was.
I'm Vicki Schleve. I ran across this on Facebook as far as coming to a dry needling workshop and was curious for the multitude of things I'd like fixed pain-wise, and yeah, what else?
How was the needling in the 5 Minute Miracle for you?
The needling was interesting. I felt very little, sometimes a little more than others, but didn't hurt. And
What was your initial response afterwards?
feeling like I want to get out and jog around and see how I feel, see how it has changed anything that is going on. So.
And what would you say to somebody who's hesitant about signing up for a workshop or coming in?
Oh, come in, because you learn a lot, and you can't learn enough. So
Well, you certainly came with a number of questions, so I'm glad you did, and thank you for your help.
yeah, I enjoyed it. Wealth of information, and
Perfect, thank you.